So we got a very important kind of additional point that we hadn't discussed about mental health, a huge issue. And then we've got a lot of things that'll come back into the solution space, I think. So some of them about joint effects, where we have infectious diseases together with undernutrition, for example. Also thinking about the kind of length of time that things happen and the kind of intergenerational effects. Lots of interesting ideas about kind of how you can do health and nutrition programming, how it fits into other kinds of resilience. So I think what we want to focus on now with the panel is really how do we look at improving health and nutrition, coming back to your point, Tiffany, I think about how do we link that up? Did I get your name right?
Yes.
Okay. How we get health and nutrition, put it in a resilience context. So how can we make a difference that way? I'm going to start with you, Harold, because you've thought about this a lot, and
yeah.
Go.
Yeah, everyone would agree that the best program would be to prevent the crisis. But as I mentioned, we will not be able to prevent every single crisis. We've listed a whole bunch of potential ones, and I'm sure there's many more. But what of the child who's malnourished? In general, the whole 1,000-day focus, which I would even call 1,200 days, from preconception through conception to the child's second birthday, is where nutrition is focused on. For two reasons. One, just looking at data, you look at stunting, and stunting increases as a child on the population of the age of the child till about 2, and then levels off. This is a global pattern, whether it's Latin America or South Asia or Africa. It levels off at about 2. It keeps on and then stays pretty constant. Secondly, all programs that have been shown to, everyone I can think of that have been shown to work at scale are programs that are done in either prenatally, during the child's time of breastfeeding or weaning. So what do we do with the 101st day? You get a child, 1,001st day, excuse me, you get a child malnourished, they're stunted. Do we write them off? Now, of course, I'm going to say no. What do we do about that? You can't reverse stunting. There's some debate about catch-up growth, that maybe there is some catch-up growth. Populations move in and out, just like Anirudh said about poverty. However, there's no programs that can move a cohort out of stunting after the age of 2, at least none that I'm aware of. However, we're looking at stunting, we're not caring about making a population of basketball players. It's not stunting we're looking at per se. We're trying to save lives, and the risk of malnutrition affecting mortality is very large, but it's usually before the age of 2. By the time they reach 2, the risk has declined, and as has been mentioned globally, the risk of child malnutrition and infant malnutrition has been moving downward at an impressive rate. So one consequence of mortality that is already at the 2-year-old level a secondary concern. Obviously, there are some risks still, but they're lower. The other thing you're concerned about is skills development. Stunting clearly correlates with reduced IQ, reduced non-cognitive, social emotional issues. Even they're showing stunting correlates with crime and divorce 20 years later, so that there's plenty of risks with stunting. We can address them directly by various programs which have been proven for early childhood development. You see a stunted child, they should be prioritized for various types of programs. Home visits have been shown to work. Home visits which bi-weekly or maybe monthly, working with the mother or the caregiver and the child on ways of stimulation. The problem in this is it's expensive. Home visits, it's expensive. Clearly, it's been shown to work in Jamaica, it's been shown now to work in Colombia, it's in the field, similar trials showing it other places. The study that is most well known is not a home visit, but a daycare center type of approach has been widely quoted by the Nobel laureate James Heckman. A very good program has affected the outcomes of the children. It cost $8,000 US in 2008 dollars, something like that. Can't be done. However, if you can get a program In Colombia, that same program probably costs $500 now. Even there, that's a lot of money for many of the countries we're dealing with. If you prioritize those child who have, for whatever reason, had a shock and they are ending up malnourished, then they should be prioritized for the early childhood development programs. And I'm talking about the ones for the children who are 18 months old to 36 months old. By the time they're 36 months old, there are programs preschool which can be done relatively inexpensively at large scale. I'm talking about the prioritization of addressing the malnutrition so that it doesn't lead to a long-term consequence by prioritizing them for early childhood development programs, which have been shown now to work in many different environments. Can I, if I have a little time, ask a question to Delia? Am I allowed to ask questions? Okay, Delia, I'd like to ask a question. You mentioned how rinderpest was the smallpox of cattle. Do we take any comfort that both smallpox and rinderpest have been eliminated globally? Do we say something about the resilience of science by that observation?
Do you want to answer that now or come back?
I'll come to it.
So, and so you're really thinking about equity in a big way.
Definitely, definitely. Oh, fine, if you give me the one more minute, thank you.
Yes, I will, yeah.
Talking about intergenerational issues, it's clear, and the studies have been shown all over the world, that by the time a child enters preschool, the poorer children have lower IQ, and it's often because of malnutrition. And then that's the reason they drop out of school, because they go to school for 3 or 4 years and they still haven't learned to read. You teach to the median child, this child is behind the median, they get bored, they drop out. If we can address the consequences of malnutrition early on, we can reduce the intergenerational transmission of poverty.